He's going to help me show you how to clean ears. So cleaning ears is a pain in the butt if your pet is not used to it. So this is something when you have puppies and when they're young, play with their ears. Give them a treat. Play with their ears, give them a treat. Play with their feet. So when you have to cut nails, that they do not, freak out on you. So get them used to having their feet touched. It makes it easier for your pet so they're not as scared. It makes it easier for you. You can save a couple of bucks and you can do it at home. And it makes it easier for your veterinarian and the technicians because we don't want to scare your pets either. So there's all sorts of cleaners out there. We're talking about right now healthy ears, okay? And the most common one that I use is called Epiotic. There's lots of different versions of ear cleaners. You want something that's going to be drying, not alcohol, please, not peroxide. You want to use something that's specifically made for pets' ears. What you're going to do, and I don't have any cotton balls on me, so we're going to have to pretend you're going to lift the ear up like this. This is a two-person job usually. You're going to take your container, you're going to put it into the ear, fill the canal. You're going to close the ear, and then you're going to rub like that. Okay? Don't squeeze. Squeezing hurts. But you're going to rub, and then you're going to stand back, and your dog's going to shake their ears like this and get ear debris everywhere. And so you may want to do this outside because it can get kind of yucky. You're going to take your cotton ball, not a Q-tip, a cotton ball, go in the ear canal as much as they'll let you, and get out the rest of the debris. If they won't let you, don't worry about it. You got as much as you can get done. Now, if it's coming back, if the debris is coming back repeatedly, even after you clean the ears, if you notice a foul odor, they're really uncomfortable, they're itching, they're miserable, things don't seem quite right, don't keep cleaning them at home. At that point, you need to bring them into the vet. Seems to be a common theme. A lot of the stuff, if you've got something wrong, it has to be diagnosed properly so we can find the proper treatment. And what I normally do is I will do what's called a cytology. So I'll take a sample of that discharge, look at it under a microscope, and it's going to tell me, is this yeast? Is it bacteria? What kind of bacteria? Is it both? Is there a whole bunch of stuff going on in here? And that's going to help me figure out what's the best medication I can give for your dog. So that's a good thing to know. And again, playing with the ears and the feet is important. When you're cutting nails, of course, I didn't bring a nail trimmer with me. Again, sometimes this is a two-person job. The pug owners out there, you know what I'm talking about. So there's a bunch of different kinds of clippers. It's what works for you, okay? If they're clear nails, it's going to be easy to see the quick. The quick is the part that has the blood vessel in it. If and when you cut it, it will bleed, and everybody's going to feel bad. But you'll all be okay eventually. Everybody eventually does this. We don't want to do that, but if it happens, don't panic. There is a stuff called Quick Stop you can put on the nail to help stop the bleeding. If you don't have that at home, you can use cornstarch. And you're going to go parallel to the nail. Okay, you don't want to go all the way up just until you see how this has, you can't, there's no nails on Tangent Man's feet, but you would kind of go parallel like this to cut those nails. If you're not sure, you can just cut them a little bit and then just do it frequently. If they're very long and the quicks are very long, and you want to get them shorter, that's what you're going to have to do, is to cut them shorter and frequently. For pets that really, really get upset with their nails, and there's a lot of them out there, you are not alone if your pet is like that. Sometimes we sedate them, and that's the best thing for them, and it's the best thing, to keep them comfortable and to keep them safe.